Imagine waking up and feeling truly restored. Your legs don't ache, your head is clear, your energy is steady, and your blood sugar graph looks calm instead of chaotic. For many people with diabetes, that picture feels out of reach until they correct three quiet deficiencies that drive fatigue, insulin resistance, nerve pain, and stubborn highs. Today, we're going deep on the top 3 vitamins most diabetics overlook and how dialing them in can support steadier numbers, stronger nerves and muscles, and a healthier heart. You'll get food sources, smart supplement strategies, absorption hacks, and an easy 7-day plan to test this safely. Let's take back control, one small fix at a time. Vitamin D. Think of vitamin D as your body's switch for resilience. It influences how responsive your cells are to insulin, how flexible your blood vessels stay, how strong your muscles feel, how well your nerves signal, and how effectively your immune system calms inflammation. Why it matters so much in diabetes. Insulin resistance, extra body fat, low sun exposure, kidney stress, and certain meds can all lower vitamin D status or block its activation. When D is low, it gets harder for insulin to do its job. Blood pressure tends to creep up. Muscles cramp and tire easily. Neuropathy symptoms can flare. And mood and immunity suffer. How to know if this is you? Classic red flags include low energy, muscle weakness, frequent infections, slow wound healing, bone or deep muscle aches, and sleep that never feels restorative. The real answer comes from a blood test, 25O vitamin D. Many clinicians target a range roughly 40 to 60 ng per milliliter for general wellness. Your target should be personalized with your healthcare provider. Food first. But be realistic. Fatty fish like salmon and sardines, egg yolks, and UV-exposed mushrooms help, but most people won't hit optimal levels with food alone, especially if they use sunscreen consistently or live far from the equator. Smart supplementation. Vitamin D3 tends to raise levels more effectively than D2. Pairing D3 with vitamin K2 can help guide calcium into bones instead of arteries. Many adults benefit from 1,000 to 2,000 IU daily. Some need more or a short repletion phase based on labs. Always test, adjust with your clinician, and recheck. Guessing leads to plateaus. Make D work harder for you. Take it with a meal that contains fat to improve absorption. Support magnesium intake, leafy greens, nuts, seeds, legumes, since magnesium helps activate vitamin D, protect the kidneys, hydrate, manage blood pressure, and keep glucose. And range activation of D depends on renal health. Try this plate this week. Wild salmon with lemon and herbs, sautéed garlicky spinach, and a side of roasted mushrooms. Sunshine walk after lunch if your doctor says it's short. Regular light exposure, not burns. Vitamin E is your membrane bodyguard. It sits inside cell membranes and lipoproteins, protecting fats from oxidation and keeping blood vessels, nerves, and eyes safer from day-to-day wear. In diabetes, oxidative stress runs hot. Vitamin E is one of the key fire extinguishers. What you may notice when E is low: more leg cramps, restless muscles, increased sensitivity in hands or feet, slower recovery from workouts or long days, drier skin, and eyes that tire easily. Over time, low E can show up as stiffer arteries, more oxidative LDL changes, and a tougher cardiovascular landscape. Where to get it from? Real food, sunflower seeds, almonds, hazelnuts, avocado, and extra virgin olive oil. Greens like spinach contribute too. Because vitamin E is fat-soluble, you'll absorb more when these foods are eaten with other healthy fats. Supplement sense. Look for natural dialpha-tocopherol, not synthetic DL. Even better, consider a mixed tocopherol and ideally tocotrienol-inclusive formula to mimic food. More isn't always better. Many people do well around 100 to 200 IU with food. while 400 IU is common in some regimens coordinating with your clinician, especially if you take anticoagulants or have bleeding risk. Absorption amplifiers and pitfalls. Pair nuts, seeds with a fat-containing meal for better uptake. Ultra-low fat. Diets can impair E-absorption. High intake of refined seed oils and trans fats increases oxidative loads. You spend more vitamin E just putting out fires. Shift toward extra virgin olive oil, avocado oil, nuts, seeds, and whole foods. Simple upgrades. Toss sunflower seeds and chopped almonds over a spinach olive oil salad. Blend avocado into a tahina lemon dressing. Add a spoon of evu to veggie soups. For dinner, try herb-crusted salmon pressed with crunched sunflower seeds for a crunchy earch topping. Vitamin B12 is the spark plug for nerves, red blood cells, and DNA repair. It's also one of the most commonly missed deficiencies in diabetes. If you take metformin, which can reduce B12 absorption over time, signals you might be low, tingling, or burning in the feet or hands. Balance or focus issues, persistent. Fatigue, pale skin, shortness of breath with exertion, low mood. And stubborn brain fog, because neuropathy and fatigue are already common in diabetes. B12 deficiency can hide in plain sight. Check it right. Ask for serum B12, and, if possible, methylmalonic acid, MMA, and homocysteine. These functional markers help catch normal butanop. Optimal Stochastic situations. Work with your clinician to interpret results in context. Food wins: clams, mussels, oysters, beef, liver, sardines, salmon, tuna, eggs, and dairy if tolerated. If you eat little or no animal food, plan on supplementing. Fortified foods help, but they're rarely enough on their own. Choosing a supplement, methylcobalamin and adenosylcobalamin are active forms. Cyanocobalamin is very stable and also effective for many people. Oral B12 is well absorbed in higher doses. Common repletion doses range 500 to 1000 mcg day, sometimes more initially, then tapered to maintenance. Some individuals benefit from periodic injections. Decide with your care team. If you're on metformin, ask to screen B12 yearly and co-supplement proactively if advised. Make it practical. A seafood night, once or twice a week. Mussels with tomato garlic broth or seared salmon with lemon. Omelets with cheese and veggies or Greek yogurt bowls with nuts and cinnamon give you B12 plus protein, fat, and fiber to flatten post-meal curves. The 7-day vitamin lift plan. Test and feel the difference. Day 1 to 2. Keep your meals simple and balance: protein plus fiber plus healthy fat at each sitting. Begin D3 with K2 if approved at your clinician recommended. Dose: take with your main meal. Add a palmful of nuts, seeds daily for vitamin E if you're a candidate for B12. Start your chosen form with breakfast, day 3 to 4. Build into vitamin-dense dinners: wild salmon with roasted mushrooms, mussels, or clams in a garlicky broth with a side salad dressed in olive oil. Swap refined snacks for an apple with almond butter or a small Greek yogurt bowl with walnuts. Day 5 to 6. Add a nerve-friendly breakfast: savory oats cooked in broth, topped with eggs and olive oil, or a veggie omelet with avocado. Keep hydration up. Walk 10 to 20 minutes after meals to aid glucose uptake. Day 7. Reflect and record energy, sleep quality, cravings, post-meal glucose readings, and any neuropathy symptoms. Know what meals gave you the steadiest curves. Book labs if you haven't already, or schedule follow-ups to tailor doses. Safety, personalization, and fast fixes. Always personalize with your clinician, especially if you have kidney disease. Take blood thinners or are pregnant breastfeeding. Vitamins can interact with medications and conditions. Don't megadose blindly. Test, supplement, retest. What gets measured gets managed. Pair changes with the basics that move the needle. Consistent meals. Protein at each plate. Non-starchy. Veggies, movement after eating, good sleep, and stress management. Vitamins are helpers, not magic by themselves. If you feel tingling worsening, new weakness, or vision changes, contact your healthcare provider promptly. Earlier action preserves function. Conclusion: vitamin D helps switch on insulin sensitivity, muscular strength, vascular flexibility, and immune calm. Vitamin E shields your cells and vessels from the oxidative stress that runs high in diabetes. Vitamin B12 fuels nerves and cognition and may quietly erode when metformin and malabsorption are in the picture. Get them from food first, supplement with intent, retest, and build meals that help your body use these vitamins well. The payoff? Flatter curves, clearer mind, stronger legs, and a steadier day stacked up, one smart choice at a time. If this helped, tell me in the comments which vitamin you're testing first and what meals you'll build around it. And if you want a full grocery list and lab tracking checklist, say list, and I'll add it in the next video.